Hello, today we're going to talk about the harmful effects of e-cigarettes. What are e-cigarettes? E-cigarettes can have different names such as vape pen, e-vaporizer, Juul, and etc., and they are all powered with a battery to create a vapor from a liquid which is called the e-juice that is being loaded into the pen. Some e-cigarettes can look like a traditional tobacco product, while some look like a USB drive, portable charger, or a car key. How do e-cigarettes work? All e-cigarettes have four main parts: reservoir, vaporizer, battery, and mouthpiece. Reservoir is the place where the e-juice is placed. The vaporizer is the part where the e-juice gets heated and vaporized, then gets inhaled from the mouthpiece. As many know, vaping is really harmful for human body, some associated directly with the device itself, and some with the different liquid solutions being vaped. Let's first take a look at the different liquids. Even though many e-cigarettes use the same process to function, what makes their effect different is the e-juice that is placed in it. Based on the Substance Abuse and Mental Health Services Administration's research, e-juices can be categorized into three categories: nicotine-containing e-juices, cannabis-containing e-juices, and flavoring-containing e-juices. The nicotine-containing e-juices stimulates adrenaline hormone to get secreted, causing an increase in blood pressure, breathing, and heart rate. Nicotine is an addictive drug that manipulates the rewarding behavior of the brain by releasing dopamine hormone, which is the happiness hormone, and the pleasure from this addictive behavior makes people more susceptible to use more dangerous drugs like opioid, cocaine, and such in the future. Based on Samsha's research, nicotine also affects the development of brain circuits that control attention and learning. Other risks include mood disorders and permanent problems with impulse control, which is basically the failure to fight an urge or impulse that may harm oneself or others. The second type is cannabis-containing e-juices. THC and CBD are the most common chemicals that could produce from cannabis. While THC can cause intoxication and the feeling of highness, CBD hasn't shown these effects. The short-term harms of using cannabis vapes is having altered senses, changes in mood, thinking difficulties, hallucinations, delusions, and psychosis. In the long term, however, these problems become more serious, causing altered brain functioning that can lead to addiction, altered brain development, cognitive impairment, symptoms of chronic bronchitis resulting from inhalation of cannabis, and increased risk of psychiatric disorders. The final one is flavoring-containing e-juices. They are the most innocent-sounding ones, however, the cute and colorful packaging shouldn't make you think that it is harmless at all. They can and do contain nicotine, and thus, it is maybe the most dangerous ones for teens. Some research shows that many teens do not even realize that vaping cartridge contain nicotine and assume the pods contain only flavoring. Even if the flavoring isn't directly harmful, the high temperatures to vaporize the e-juice can cause harmful chemicals to get produced. Vitamin E acetate is another chemical that is found in e-juices. It is a thickening agent that has become CDC's concern among people with vaping-associated lung injuries. They recommend that people should not use any product containing vitamin E acetate or any vaping products containing THC. As I said, there is also harm that comes from the process of vaporization itself by producing toxic chemicals. Even the ingredients used in liquid solutions that are considered to be safe by FDA for oral consumption may take on different properties during the vaporization and potentially be harmful. Also, many vape pens are found to be contaminated with heavy metals, which can cause neurotoxicity, cardiovascular disease, respiratory disease, and lung cancer. So we talked about all the harmful effects of using e-cigarettes. but who harms the most from using them? This is a news report from healthline.com. Vaping lung disease. Over 2,200 cases reported. Teen gets popcorn lung. The answer to my question is youth. Teenagers get harmed by using e-cigarettes the most for several reasons. They think that they are not as dangerous as smoking cigarettes. Also, they are more likely to take risks with their health since they are at a young age and underestimate how addictive nicotine is. However, teens are especially susceptible to addiction to nicotine, whether the substance comes from a cigarette, e-cigarette, or another tobacco product. The nicotine in an e-cigarette can change the young brain and get kids hooked, making them more susceptible of becoming addicted in the future. Addiction can impact the ability to focus. Dr. Tashkaran has observed this with the adolescents he works with, who reported that vaping initially increases their alertness and attention, but then experience a decrease in attention span. One student, for example, was able to sit through practice ACT exams, but after juuling for 6 months, she couldn't sit still because she started craving and couldn't think of questions and just started fidgeting. Their future is in danger. At the early teenage years, the size of the brain is as big as it's going to get, but the cognitive development still continues. The brain builds synapses, and it's the peak age for them to easily learn new skills. Unfortunately, the behavior of addiction also comes easier. Teens should bear in mind that the choices made in youth to use any tobacco product can train the brain to yearn for more nicotine, setting the stage for potentially devastating health consequences down the road. One study of 12th graders found that kids who vaped but were not previously smokers were more than 4 times as likely to move away from the perception of cigarettes as posing a great risk of harm. A Yale study done in 2018 found that among students at 3 Connecticut public schools, those who used e-cigarettes were more likely to smoke regular cigarettes in the future. Also, the recent studies of Stanford found that teenagers and young adults who vape have a higher risk of getting COVID-19. Among young people who were tested for the virus that causes COVID-19, those who vaped were 5 to 7 times more likely to be infected than those who did not use e-cigarettes. And among the participants who were tested for COVID-19, those who had ever used e-cigarettes were 5 times more likely to be diagnosed with COVID-19 than non-users. A primary concern is that many young people view vaping as socially acceptable. When youth were asked whether their peers approved of nicotine vaping, 44% said yes, compared to only 23% who said their peers approved of cigarette smoking. Another study found that youth said they vaped because their friends, peers, and siblings did, and they thought it was cool, whereas they acknowledged the harms and negative components of smoking cigarettes. For many youth, vaping is seen as less harmful, better, and cheaper than smoking cigarettes. Since no combustion occurs during the vaping process, those who vape consider nicotine vaping products to be less harmful than traditional cigarettes because many do not produce carbon monoxide. These are some of the many reasons why teens start vaping. In 2019, over 5 million youth reported currently vaping nicotine, cannabis, and/or flavorings without active drug substances, an increase from 3.6 million youth in 2018. Specifically, nearly 4.1 million high school students and 1.2 million middle school students in the United States reported currently using nicotine vaping devices. A common misconception is that using e-cigarettes help quitting tobacco products, but that is not true. Some people believe e-cigarettes may help lower nicotine cravings in those who are trying to quit smoking. However, e-cigarettes are not an FDA-approved quit aid, and there is no conclusive evidence on the effectiveness of vaping for long-term smoking cessation. If you want to quit smoking, you can do it. It is best to never start smoking, but it's never too late to stop either. A study found that people who use only e-cigarettes increase their risk of developing lung disease by about 30% compared to non-users. With the scientific findings that justifies the harmful effects of e-cigarettes, federal governments have taken some but limited precautions to protect youth. On December 20, 2019, the federal government raised the federal minimum age which retailers may sell tobacco products, including e-cigarettes containing nicotine, to 21 years. The federal law is only directed to retailers. There is no federal law to prohibit anyone under age 21 from purchasing tobacco products. However, states have the ability to pass minimum purchasing age restrictions, which many have. Cannabis products containing THC are regulated at the federal level. As of December 2018, cannabis products that do not contain THC, such as CBD, are legal at the federal level, as are hemp products that contain no more than 0.3% THC. Cannabis products containing THC are increasingly becoming legalized in several states for medicinal and recreational use, but remain illegal federally if the THC content is more than 0.3% at the federal level. As of August 2019, 33 states have legalized medical marijuana, and 11 states and DC have legalized the non-medical adult use of marijuana. However, even with the laws, most vape vendors, 63 to 68%, did not require age verification or relied entirely on strategies that cannot effectively verify age, such as checking box to certify the buyer is of legal age, or a statement that says an order certifies the buyer is of legal age. In a study of youth aged 15 to 17 years, 31% said they obtained their main vaping device from a store, vape shop, or online retailer, which only shows how laws and rules aren't enough to protect kids from purchasing e-cigarettes itself. So how can we help? First, start by asking questions. Ask them what they know. And be ready to listen. They may say it's harmless, it's just flavored water vapor, but it's not, and you'll share more about that. Tell them about the dangers. Vaping puts you at risk of exposure to many harmful chemicals. These chemicals can cause cancer and harm almost every organ in your body. Teens are especially sensitive to nicotine's addictive effects because their brains are still developing, and this makes it easier to get hooked. Using nicotine at a young age can also rewire your brain to become more easily addicted to other drugs. Scientists have also identified several harmful compounds in e-cigarettes, such as propylene oxide, that can irritate the eyes, skin, respiratory tract, and depress the central nervous system. Last, you can be a good role model. Set a positive example by being vape and tobacco free. You can also make a family media use plan to help limit the influence of these ads on your children. Unlike ads for regular cigarettes, e-cigarette ads are legally allowed on air on TV. A study in February 18 Pediatrics found that teenagers who watched videos about tobacco product online, for example, were more likely to try and use tobacco products more frequently. Last but not least, find a hobby for your teen. Adolescence is a time when teens are trying to find their identity. It is important for parents to be positive about their teens' talents and goals, whether it be basketball or social studies. These are the sources that were used to prepare this PowerPoint slide about the harmful effects of e-cigarettes. Thank you for listening.